Today we're going to talk about one of the most interesting discussions that occurred at the 6th World Symposium in Pulmonary Hypertension, and that had to do with the definition of pulmonary arterial hypertension. Is the definition of pulmonary arterial hypertension going to change? And if so, how? Well, let's first review the discussion from the 5th World Symposium on the hemodynamics of pulmonary hypertension. So at that symposium, we discussed the definition of all types of pulmonary hypertension would be a mean pulmonary artery pressure of greater than 25 millimeters of mercury at rest as measured by a right heart catheterization. To be considered group 1 pulmonary arterial hypertension, you also had to have a mean pulmonary capillary wedge pressure of less than 15 and a pulmonary vascular resistance of greater than 3 Wood units. Now, the discussion about whether or not we should redefine this hemodynamic definition really cited the original World Symposium in Geneva in 1973. And at that time, pulmonary hypertension was arbitrarily defined as a mean pulmonary artery pressure of greater than 25, measured by right heart catheterization in the supine position at rest. And this really remained the definition of pulmonary hypertension throughout time, throughout clinical practice, in terms of all the clinical trials that were done, and really in terms of the definition at every single World Symposium that has occurred since then. However, accumulating data in healthy individuals suggests that maybe this is really a little bit lower. In many patients who've been studied, the normal mean pulmonary artery pressure is 14 with a standard deviation of 3.3. So if you add 2 standard deviations to that 14, you really get up to a little bit less than 20. That really should encompass 95% of the population. And so theoretically, a mean pulmonary artery pressure above 20 is abnormal. Now, this doesn't necessarily define a disease, but really is outside of the range that we would expect in the majority of the population. It's also important to remember that in different conditions, a mean pulmonary artery pressure is associated with an increased risk of mortality. Although, while that association between pressure and mortality has been demonstrated, there have not been trials that show decreasing that pulmonary artery pressure improves survival. So it's possible that a mild increase of mean pulmonary artery pressure could simply be a marker of underlying disease severity. There was a paper that came out really just in advance of the World Symposium that sparked the discussion, and this was a large cath database of patients who had pulmonary hypertension due to many reasons. And this group sectioned off the patients with pulmonary hypertension, or the patients in general, into quartiles based on what their mean pulmonary artery pressure was. So the lowest quartile had a mean pulmonary artery pressure of less than 17. What they called upper normal quartile, 17.4 to 20.6. What we consider borderline pulmonary hypertension, 20.6 to 24.9. And then the classic definition of pulmonary hypertension, greater than 25. So if you look at those different groups, you can see that as the pulmonary artery pressure goes up, the 6-minute hall walk in the far left graph goes down. With each increasing group of pulmonary artery pressures, the hall walk is less. In the middle panel, you see that the peak VO2 as measured by cardiopulmonary exercise testing is less. And on the right panel, you see that the mortality is higher as the pulmonary artery pressure goes up. Now, this is just an epidemiologic observation. It doesn't really tell cause and effect. It just demonstrates that in this database population, that as pulmonary artery pressures go up, patients were less able to exercise, had impaired 6-minute hall walks and cardiopulmonary exercise testing, and had higher mortality. Now, it's important to remember that this is a population that had a number of other comorbid illnesses, which may have contributed as well. But this data and increasing data since the last World Symposium led Task Force 4 to ponder the question, should we redefine pulmonary hypertension and precapillary pulmonary hypertension? And they proposed that the mean value for, or the mean pulmonary artery pressure of greater than 20 should be the upper limit of normal. Again, highlighting the fact that it is not necessarily a disease, but an abnormal increase of pulmonary artery pressure. And they proposed the new definition of precapillary pulmonary arterial hypertension to be a mean pulmonary artery pressure greater than 20, so that's the new definition of pulmonary hypertension, but very importantly, retain the wedge pressure less than 15 and the pulmonary vascular resistance of greater than 3. And I think it was a very important discussion. It was an important discussion of new data that had been published since the last World Symposium, and it's important to keep this in mind as we see patients. So thank you for joining me today for this important conversation.